So today we are discussing about deep fascia of neck. The deep fascia of neck is a fascia or fasciae coli which covers the muscles of the neck. The deep fascia of the neck is called fascia coli, which covers or invests the muscles of the neck, and from outside inwards, the deep fascia of the neck consists of three layers. One is investing layer of deep cervical fascia, investing layer, and the second one is pretracheal layer, and the third one is prevertebral layer. So the investing layer of deep cervical fascia, from outside inwards, it consists of three layers: investing layer, pretracheal layer, and prevertebral layer. And the space between the pretracheal layer and prevertebral layer forms the visceral compartment, which these two layers, they surround the viscera of the neck. That means they surround the thyroid gland, and also they surround some vessels of the neck, form the eurovascular compartment. So from inside outwards, the deep fascia consists of three layers: investing layer of deep fascia, pretracheal fascia, and the prevertebral fascia. Okay, so coming to the investing layer of deep cervical fascia. So for the first layer is the investing layer of deep cervical fascia. So the deep cervical fascia, tracings of the deep cervical fascia behind the deep, from the ligamentum nuchae. So this is the ligamentum nuchae of the seventh cervical vertebra. So from the cervical spine of seventh cervical vertebra, ligamentum nuchae extends, and the investing layer of deep cervical fascia, it extends from the ligamentum nuchae, and here it splits into two to enclose the trapezius muscle. So the deep cervical fascia, it splits into two to enclose the trapezius muscle, and along the anterior border of muscle, it again forms one layer, and again it splits into two to enclose the sternocleidomastoid muscle, and here it becomes one layer, and it encloses some spaces called supraclavicular spaces and suprasternal spaces. So the investing layer of deep cervical fascia, tracing behind, it splits horizontal extent of the investing layer of deep cervical fascia from ligamentum nuchae. It splits to enclose the trapezius muscle and forms the roof of the posterior triangle. Again it splits to enclose the sternocleidomastoid muscle, and again it forms the roof of the anterior triangle. Coming to the attachments of the investing layer of deep cervical fascia. So the deep cervical fascia, above, it is attached to external occipital protuberance here, and the superior nuchal lines here, and to the mastoid process here, and also external acoustic meatus, zygomatic arch, and lower border of the angle of the mandible. So from behind the investing layer of deep cervical fascia, it is attached to external occipital protuberance, superior nuchal lines, mastoid process and part of temporal bone, and external acoustic meatus, and zygomatic arch, and the lower border of the angle of the mandible. That is the attachment of the investing layer of deep cervical fascia above. And below the investing layer of deep cervical fascia, so above, it is attached to the external occipital protuberance and superior nuchal lines, and mastoid process and mastoid part of temporal bone, external acoustic meatus, lower border of zygomatic arch, and lower border of the angle of the mandible up to the symphysis mentae, and continuous with the similar fascia of the opposite side. And coming to the behind, it is attached to the ligamentum nuchae. The investing layer of deep cervical fascia, behind, it is attached to the ligamentum nuchae, and in front it is continuous with the similar fascia of the opposite side, and it is attached to the hyoid bone. Above, it is attached to these structures, and below it is attached to, from behind to forwards, it is attached to spine and acromion process of scapula, and also it is attached to clavicle here, and it is attached to the manubrium sternum here. So that is the extensions of the investing layer of deep cervical fascia. Again I am repeating, the investing layer of deep cervical fascia, it is behind attached to ligamentum nuchae, and in front it is continuous with the similar fascia of the opposite side, and it is attached to the hyoid bone here. We know the structure of hyoid bone. So this is the hyoid bone, which is having greater cornu, lesser cornu on the body of the hyoid bone. So the investing layer of deep cervical fascia traced in front, it is attached to the body of the hyoid bone, and it is continuous with the fascia of the opposite side. And when it is attached to the, it is traced above, it is attached to the external occipital protuberance, superior nuchal lines, mastoid process, lower border of zygomatic arch, and lower border of the mandible up to the symphysis mentae, where it is continuous with the similar fascia of the opposite side. And traced below from behind forwards, it is attached to the spine and acromion process of scapula, and then clavicle, and to the manubrium sternum. So these are the attachments of the investing layer of deep cervical fascia. And coming to the tracings of the deep cervical fascia, above tracings, horizontal tracings and vertical tracings. So horizontal tracings of the investing layer of deep cervical fascia, from the ligamentum nuchae, it splits to enclose the trapezius muscle, and again it becomes one layer, forms the roof of the posterior triangle of the neck, and again it splits to enclose sternocleidomastoid muscle, and again it forms to one layer which forms the roof of the anterior triangle of the neck, and it encloses some spaces called suprasternal spaces and supraclavicular spaces. So that is the horizontal extent of the investing layer of deep cervical fascia. So starting from the ligamentum nuchae, the investing layer of deep cervical fascia splits to enclose the trapezius muscle, and it forms into one layer, and it encloses the sternocleidomastoid by splitting, and it forms the roof of the anterior triangle, and it encloses some spaces called suprasternal spaces and supraclavicular spaces. That is the horizontal extent of the investing layer of deep cervical fascia. Coming to the vertical extent of the deep cervical fascia, so the deep cervical fascia, it encloses two glands, that is submandibular gland and parotid gland. So submandibular gland, so it encloses it splits to enclose the submandibular gland. So when we take the coronal sections through the submandibular gland, it splits to enclose the submandibular gland. So this is the submandibular gland. It splits to enclose the submandibular gland by covering its lower and medial surfaces. So the investing layer of deep cervical fascia, it splits to enclose the submandibular gland. The superficial layer, it attached to the lower border of the mandible, and the deep layer, it is attached to the mylohyoid line of the mandible. So that's the two layers which enclose the submandibular gland. And coming to the parotid gland, the investing layer of deep cervical fascia, it splits to enclose the parotid gland. So by entering into the parotid gland, lower part of the parotid gland, the investing layer of deep cervical fascia, it splits into two. The superficial layer is very thick, and it forms a very thick layer, false capsule of the parotid gland, and it is attached to the lower border of zygomatic arch. So this is the superficial layer, and it is attached to the lower border of zygomatic arch, and from there it becomes very thick, and it forms the parotidomasseteric fascia by blending with the epimysium of the masseter. And coming to the deep layer, the deep layer of the investing layer of deep cervical fascia, it is attached to the styloid process and also to the tympanic plate. From the styloid process, it is thickened to form one ligament called stylomandibular ligament. So it is thickened to form one ligament called stylomandibular ligament. So that is the vertical extent of investing layer of deep cervical fascia. So from the horizontal extents, from the ligamentum nuchae, it splits to enclose trapezius and forms the roof of the posterior triangle, and splits to enclose sternocleidomastoid and forms the roof of the anterior triangle, and continues with the fascia of the opposite side. And coming to the vertical extents, it splits to enclose two glands, that is submandibular gland and parotid gland. By reaching the submandibular gland, it splits to two layers. The superficial layer is attached to the lower border of the mandible, and the deep layer, after enclosing the medial surface of the gland, it is attached to the mylohyoid line. And coming to the parotid gland, the investing layer of deep cervical fascia, it splits to enclose the parotid gland by dividing into superficial layer and deep layer. Superficial layer, it is very thick and it is attached to the lower border of zygomatic arch. From lower border of zygomatic arch, here is the lower border of zygomatic arch, and from there the lower border of zygomatic arch, it is blends with the epimysium of the masseter by forming the thick parotidomasseteric fascia. And coming to the deep layer of the investing layer of deep cervical fascia, it is very thin and it is attached to the tympanic plate of tympanic. Here is the external acoustic meatus. Here it is attached to the tympanic plate and also attached to the styloid process, where it is thickened to form the stylomandibular ligament. So the stylomandibular ligament extends from the tip of the styloid process to the angle of the mandible. So this is the angle of the mandible. That is the vertical extent of the investing layer of deep cervical fascia above, and below the investing layer of deep cervical fascia, it encloses two spaces, that is from above the manubrium sternum. Here we can palpate the manubrium sternum. Above the manubrium sternum, one space is there, that is called suprasternal space, or we call it as burn space. We can otherwise call it as burn space. And above the clavicle, it encloses one space, that is called supraclavicular space. So coming to the burn space, so the investing layer of deep cervical fascia, it comes down and it is attached to the anterior and posterior borders of the manubrium sternum. So between the two layers of the manubrium sternum, investing layer of deep cervical fascia, we have jugular venous arch here. So the jugular venous arch, it connects the anterior jugular veins. So the jugular venous arch, it connects the anterior jugular veins. This thing we can see in the suprasternal space or burn space. And also we can see sometimes a lymph node and sternal heads of sternocleidomastoid. They are also seen in the suprasternal space or burn space. So the investing layer of deep cervical fascia, below it splits into two layers to enclose one space, that is called suprasternal space or burn space. These two layers, they are attached to the anterior and posterior layers of the manubrium sternum. And here the suprasternal space consists of, or burn space consists of, jugular venous arch. Jugular venous arch is nothing but it connects the both anterior jugular veins. It connects the anterior jugular veins, that is the jugular venous arch, and also it contains some sternal heads of sternocleidomastoid. Sternal heads of sternocleidomastoid, jugular venous arch, and also it consists of interclavicular ligaments which connects the clavicle, and sometimes a lymph node is also seen in the suprasternal space and burn space. Coming to the under space, that is called supraclavicular space. Supraclavicular space, it is the investing layer of deep cervical fascia. When it comes down, it again splits into two to attach it to the anterior and posterior borders of the upper surface of the clavicle here. So it splits into two. So this is the clavicle. So the investing layer of deep cervical fascia splits into two to attach it to the anterior and posterior borders of the upper surface of the clavicle. The posterior layer, it also covers the inferior belly of omohyoid and it forms the omohyoid fascia. So that's about the supraclavicular space. And in the supraclavicular space, we can see the anterior jugular veins. We can see anterior jugular veins in the supraclavicular space. So that's about the vertical disposition of the investing layer of deep cervical fascia. Horizontal disposition, we know that this is splitting of the muscle and forms the roof of the two triangles. So the investing layer of deep cervical fascia, it splits to enclose two muscles. One is trapezius and one is sternocleidomastoid. It forms the roof of two triangles. One is posterior triangle and one is anterior triangle. It splits to enclose two spaces, that is suprasternal space and supraclavicular space. It splits to enclose two glands, that is submandibular gland and also parotid gland, and it gives two facial processes that gives attachment to pretracheal fascia and prevertebral fascia. So that's about the investing layer of deep cervical fascia. So coming to the next layer. So investing layer, after the completion of investing layer, we have another layer that is called pretracheal layer. Coming to the pretracheal layer of the deep cervical fascia, the pretracheal layer horizontal disposition is, so the pretracheal layer, it comes below the sternocleidomastoid. It comes as the facial process below the sternocleidomastoid. From the posterior layer of the sternocleidomastoid, we know that the investing layer of deep cervical fascia, it splits into two. This is the anterior layer and this is the posterior layer. So the pretracheal fascia, it comes as a facial prolongation from the posterior layer of the investing layer of deep cervical fascia, and here it forms the anterior wall of carotid sheath. So the anterior wall of carotid sheath is formed by the pretracheal fascia, and then it splits to enclose the thyroid gland, the anterior layer and posterior layer. So this splits to enclose the thyroid gland. From here, the investing layer of deep cervical fascia, the pretracheal fascia, it splits to enclose the thyroid gland, that is anterior layer and posterior layer. The anterior layer which covers the thyroid gland forms the false capsule. The anterior and posterior layer which covers the thyroid gland forms the false capsule of the gland. Here the anterior layer, it is thickened and it is attached to the cricoid cartilage here. This is called ligament of Berry. This part we call it as ligament of Berry. So the anterior layer of pretracheal fascia, it is thickened, which connects the thyroid gland, which connects the isthmus of the thyroid gland to the cricoid cartilage here. So this is the cricoid cartilage. So this one is called ligament of Berry, and the posterior layer is very ill-defined and continues with the similar layer of the opposite side. So the expansion, the swelling of the thyroid gland extends backward because the posterior layer, it is well defined and it obstructs the esophagus, causing dysphagia. So the posterior layer is ill-defined and continues with the similar fascia of the opposite side, and the posterior layer, because of the posterior layer, it is very thin, so the swelling of the thyroid gland extends backwards. So extend backwards and it obstructs the esophagus, it compresses the esophagus, causing dysphagia. So that is the pretracheal fascia horizontal extent. So coming to the again horizontal extent of pretracheal fascia, so it comes as a facial process from the posterior layer of investing layer of deep cervical fascia from the sternocleidomastoid, and here it forms the anterior wall of carotid sheath. From here, the pretracheal fascia splits to enclose the thyroid gland. The anterior layer, it is thickened and it forms the ligament of Berry, which is attached to from the isthmus of thyroid gland to the cricoid cartilage, and the posterior layer covers the posterior part of the gland, posterolateral surface of the gland. It is ill-defined and it is very thin and it continues with the fascia of the opposite side. And here what happens is, because of the posterior layer is very thin, the swelling of the thyroid gland, it extends backwards, causing the esophageal obstruction called dysphagia. So that's about the pretracheal fascia horizontal disposition. And coming to the pretracheal fascia vertical extent, the pretracheal fascia, it encloses it is attached to the hyoid bone and also to the oblique line of thyroid cartilage. It is attached to the hyoid bone and also here we have oblique line of thyroid cartilage is here, and the pretracheal fascia, it is attached to the hyoid bone and also oblique line of thyroid cartilage. Because of the pretracheal fascia attachment to the hyoid bone, oblique line of thyroid cartilage and cricoid cartilage, the thyroid gland moves above and down with deglutition. So the thyroid gland moves above, movement is done with the deglutition because of the attachment of the pretracheal fascia to here. So the pretracheal fascia vertical disposition is, it is attached to the head bone on oblique line of thyroid cartilage, and also it is here attached to the cricoid cartilage from the isthmus of the thyroid gland to the cricoid cartilage. We call it as the thickening part, we call it as ligament of Berry, that is the horizontal one, and the vertical disposition of the pretracheal fascia is, it is attached to the head bone and also oblique line of thyroid cartilage. Where from the oblique line of thyroid cartilage, we know that various muscles gets inserted and adhesed from the oblique line of thyroid cartilage. The thyroid gland moves ups and down with deglutition because of the attachment of the pretracheal fascia to the head bone, thyroid cartilage, head bone, thyroid cartilage, and also to the cricoid cartilage. So that's about the pretracheal fascia. And Shivagar, so the pretracheal fascia, it is attached to the vertical tracings, it is attached above to the head bone and also oblique line of thyroid cartilage, and it is attached to the isthmus, it encloses the thyroid gland. From the head bone to the isthmus of the thyroid gland, the pretracheal fascia, it is thickened to form ligament of Berry, ligament of Berry. Here we can see the ligament of Berry here. So the pretracheal fascia often splits to enclose the thyroid gland, and extension from thyroid cricoid cartilage to the isthmus of the thyroid gland. This one we call it as ligament of Berry. And coming to the tracings below, the investing layer, that is pretracheal layer of the deep cervical fascia, it joins with the, it continues with the fibrous pericardium as well as pleural membrane, suprapleural membrane. It also continues with the fibrous pericardium and also to the suprapleural membrane. So that's about the vertical tracings of the investing layer of deep cervical fascia. So it is above, it is attached to the head bone and with oblique line of thyroid cartilage, and it splits to enclose the thyroid gland, and below it is thickened, it is continuous with the apex of the fibrous pericardium, and also it is continuous with the Simpson's fascia called or suprapleural membrane. That is the vertical extent of the pretracheal fascia. So coming to the prevertebral fascia, so the prevertebral fascia extends as a facial process beneath the sternocleidomastoid, and it forms the posterior wall of the carotid sheath. So it extends from the posterior layer of the sternocleidomastoid, extends from the facial process from the investing layer of the deep cervical fascia deep to the sternocleidomastoid, and it forms the posterior wall of carotid sheath, and here it encloses the cervical vertebra and paravertebral muscles. And sometimes a facial sling extends backward, and it covers the levator scapulae, scalenus anterior, scalenus medius, and scalenus posterior, scalenus medius, and scalenus anterior muscles, and it is continuous. It encloses all these muscles and disappears below the trapezius muscle. So the prevertebral fascia horizontal extent. So the prevertebral fascia, it starts as a facial process beneath the sternocleidomastoid, and it forms the posterior wall of carotid sheath, and also it covers the cervical vertebrae as well as paravertebral muscles, and a facial sling extends backwards, covers the levator scapulae here, scalenus posterior, scalenus medius, and scalenus anterior muscles, and it is attached to the lower part of trapezius muscle where it is disappears. That is the horizontal extension of the prevertebral fascia. So the prevertebral fascia, it forms the roof floor of the posterior triangle by enclosing these three muscles, because the floor of the posterior triangle, it is formed by semispinalis capitis here, semispinalis capitis, splenius capitis, levator scapular and scalenus medius. This forms the floor of the posterior triangle. So it covers this prevertebral fascia. Because it covers all these muscles, it forms the floor of the posterior triangle. And in between the scalenus anterior and scalenus medius muscle, it also covers the brachial plexus and cervical plexus. It also covers the brachial plexus and cervical plexus. The brachial and cervical plexus, they are present beneath the prevertebral layer, and also it forms tubular investment around the course of brachial plexus to the apex of axilla as axillary sheath. So the axillary sheath, it is derived from the prevertebral fascia, which is nothing but a deep cervical fascia, a subdivision of the deep cervical fascia. So that is the horizontal extent of the prevertebral fascia. Coming to the vertical extent of the prevertebral fascia, so the prevertebral fascia, it is attached to upwards to the bones of the base of the skull. So it is attached above to the bones of the base of the skull here, and below the prevertebral fascia, it divides into anterior and posterior layers. Anterior layer, we call it as alar fascia, and it is continuous with the blends with the buccopharyngeal fascia. Okay, so it blends with the buccopharyngeal fascia, and so that is the vertical extent of the prevertebral fascia. And coming to the horizontal extent and vertical extent, we have another tubular investment of the deep cervical fascia is there. We call it as carotid sheath. So carotid sheath, it is derived from, so in the carotid sheath we will able to see, so carotid sheath, it is a neurovascular compartment, which the anterior layer of carotid sheath, so this is the carotid sheath. Okay, the anterior layer of carotid sheath is formed by the prebrachial fascia, and the posterior layer of carotid sheath is derived from the prevertebral fascia. We can see the carotid sheath in the carotid triangle, which is nothing but anterior, one of the anterior triangles of neck. We can see the carotid sheath. It is a tubular investment which covers the common carotid artery along with the internal carotid artery, internal jugular vein and vagus nerve. Common carotid artery lies medial and vein lies more lateral, and the vagus nerve, this is the vagus nerve, and the vagus nerve lies more deep to these two vessels. And one more thing is the posterior layer of carotid sheath, which is formed by the prevertebral fascia. It is very thin around the internal jugular vein, because to allow the expansion of the internal jugular vein. So that's about the carotid sheath. So the carotid sheath, it is a tubular investment, it is a neurovascular compartment, and it encloses the common carotid artery as well as internal carotid arteries, and also internal jugular vein and vagus nerve. Artery lies medial, internal jugular vein lays lateral, and the vagus nerve it lies more on the more posterior plane. And the anterior wall of the sheath, it is derived from the pretracheal fascia, and the posterior wall of the sheath, it is derived from the prevertebral fascia. The part of the sheath which covers the internal jugular vein, it is very thin in order to allow the expansion of the internal jugular vein. And coming to the structures piercing the carotid sheath, the carotid sheath, it is pierced by external carotid artery branches. The external carotid artery, it pierces the carotid sheath, and last four cervical nerves, that is accessory, that is glossopharyngeal, cardiac branches of the vagus, spinal accessory and hypoglossal nerve. These also pierce the carotid sheath. So the structure, that's about the structures piercing the carotid sheath. Diagram much. So that's about the deep cervical fascia. And coming to the some spaces present in the deep cervical fascia, one is retropharyngeal space and the second one is lateral pharyngeal space. Coming to the retropharyngeal space, the retropharyngeal space, it is situated behind the pharynx. So this is the retropharyngeal space. Okay, the boundaries of the retropharyngeal space are anteriorly by the buccopharyngeal fascia, which is a fascia which covers the constrictors of pharynx. This is the superior constrictor muscle of pharynx. So this is the buccopharyngeal fascia, where I have presented with green color lines. Okay, this is the buccopharyngeal fascia, and anteriorly to this, so this is the retropharyngeal space. Anterior boundaries are the superior constrictor muscle, nothing but pharynx covered by superior constrictor muscle covered by buccopharyngeal fascia. Posteriorly the prevertebral fascia. This is the prevertebral fascia which covers the cervical vertebra as well as the paravertebral muscles. Behind we have cervical vertebra is here present here. On either side we have carotid sheath. On either side we have carotid sheath. Sometimes what happens is a facial sling from the buccopharyngeal fascia extends to the prevertebral fascia, divides the lateropharyngeal space into two compartments. So this is the retropharyngeal space which is present behind the pharynx. So the relations of the retropharyngeal space in front to the superior constrictor muscles of the pharynx and the buccopharyngeal fascia covering the constrictors of pharynx. Behind prevertebral fascia, on either side carotid sheath. Above it is attached, it is limited by the base of the skull. Below it is continuous with the superior mediastinum of the thorax. So any pus collected in the retropharyngeal space during pyogenic infections, it will also pass to the superior mediastinum of the thorax because of its continuation at the superior mediastinum of the thorax. So that's about the retropharyngeal space. So here is the carotid sheath. We know that in the carotid sheath we have in the carotid sheath we have internal jugular vein. So internal jugular vein is here, and here we have carotid artery, and this is the internal jugular vein, and we have on the most posterior axis we have vagus nerve. So this is the carotid sheath, right? So the carotid sheath forms the lateral boundary. We know that the anterior wall of the carotid sheath is formed by the pretracheal fascia and the posterior wall is formed by the prevertebral fascia. And this carotid sheath, it is exposed during block dissection in order to remove the deep cervical lymph nodes. That is the very important aspect, applied aspect of the carotid sheath. The carotid sheath is exposed during block dissection of neck in order to remove deep cervical lymph nodes. That is the applied importance of the applied anatomy of the carotid sheath. And that's about the retropharyngeal space. The retropharyngeal space, it is situated on the back side of the pharynx. That's why we call it a retropharyngeal space. In front it is related to the buccopharyngeal fascia which covers the constrictors of pharynx. Behind it is continuous with the deep cervical fascia. So that is nothing but prevertebral fascia. And on either sides we have carotid sheath and its contents. And coming to the base of the skull, it is attached and limited above by the base of the skull, this retropharyngeal space. And below it is continuous with the superior mediastinum of the thorax. So any infection in the retropharyngeal space, may pass into the superior mediastinum of the thorax. Any pyogenic infections, they pass into the superior mediastinum of the thorax. And sometimes the retropharyngeal space, the facial sling extending from the buccopharyngeal fascia to the prevertebral fascia divides the retropharyngeal space into two compartments. So coming to the contents of the retropharyngeal space, here we have nothing much more important contents are there. Some loose areolar tissue is present in the retropharyngeal space, and also some pharyngeal plexus and nerves are present, and sometimes lymph nodes are present in the retropharyngeal group of lymph nodes. They are present in the retropharyngeal space. So some loose areolar tissue, retropharyngeal group of lymph nodes, and also pharyngeal plexus and nerves, they are present in the retropharyngeal space. And coming to the lateral pharyngeal space, so lateral pharyngeal space in the name itself it decides is present on either side of the pharynx. So when we take this is the pharynx, it present on either side of the pharynx. So this is the lateral pharyngeal space. It is bounded medially by the pharynx and above and laterally by the parotid gland, and above and laterally and somewhat here it is also related to head bone, and also to the medial pterygoid muscle. So on the lateral relations of the parotid gland, hyoid bone and medial pterygoid muscle, and it is attached above to the base of the skull, and that's about the, and behind it, the posterior boundaries are the carotid sheath and also styloid process and styloid group of muscles. This forms the posterior boundaries of the lateral pharyngeal space. So lateral pharyngeal space boundaries are here the pharynx and covered by the buccopharyngeal fascia, and also it is laterally it is related to parotid gland, hyoid bone and medial pterygoid muscle. We know that medial pterygoid muscle, not hyoid bone, it is the ramus of the mandible. So this is the ramus of the mandible. We know that the medial pterygoid muscle, it is attached to the acule of the mandible on the medial surface. So this is the medial pterygoid muscle. Okay, this is the body of the mandible and this is the ramus of the mandible. Behind it is related to styloid groups of muscles, styloid process and styloid groups of muscles, and behind it also related to carotid sheath and its contents. Okay, so that's about the lateral pharyngeal space. The important contents of the lateral pharyngeal space is it consists of fibrofatty tissue, and also it consists of, also this part consists of maxillary nerve and maxillary vessels. So that's about the lateral pharyngeal space. So that's about the deep cervical fascia. So the deep cervical fascia, it is a tubular investment around the muscles of the neck. Okay, and it forms and it passes in between the spaces between viscera, vessels and also muscles. And from superficial to deep, the deep cervical fascia consists of 3 layers: investing layer of deep cervical fascia, prevertebral layer and pretracheal layer. So the pretracheal is the middle layer in between the investing layer and the prevertebral layer. And coming to the investing layer of the deep cervical fascia, here it is attached to the external occipital protuberance here, and it is attached to the superior nuchal lines on either side of the external occipital protuberance, and is attached to the external acoustic meatus, mastoid process, lower part of zygomatic arch. It is attached to the lower border of the body of the mandible, extending from the angle of the mandible to the symphysis mentae, where it is continuous with the similar fascia of the opposite side. Okay, and below, and coming to the horizon below, it is enclosed to the spine and acromion process of scapula, and also to the mandibular sternum and also to the clavicle. Okay, in front it is attached to the hyoid bone. Behind it is attached to the ligamentum nuchae. So that's the attachment of the investing layer of deep cervical fascia. And coming to the tracings, it encloses the trapezius muscle and forms the roof of the posterior triangle, and it encloses the sternocleidomastoid, where it forms the roof of the anterior triangle. And coming to the vertical extent, it encloses the 2 salivary glands, that is submandibular and parotid gland, where by enclosing the lower surface of submandibular gland, it is attached to the lower border of the mandible, and by enclosing the medial surface of submandibular gland, it is attached to the mylohyoid line of the ramus of the mandible. We have mylohyoid line is here to at the linear surface of the mandible. We have mylohyoid line is there. It is attached there, the deep layer, and it also splits to enclose the parotid gland. The parotid gland from the superficial layer of the parotid gland, it is very thick and is attached to the lower border of zygomatic arch, and from there it is attached to blends with the epimysium of the masseter by forming the parotidomassetery fascia, and below the layer that is very thin, the deep layer, and it is attached to the tympanic plate as well as styloid process. Here we have styloid process is here. This is the styloid process. It is attached to the styloid process, where it is thickened to form a ligament called stylomandibular ligament, which extends from the tip of the styloid process to the mandible. So that's about the tracings, vertical tracings of the deep cervical fascia. Okay, and coming to the pretracheal fascia, the pretracheal fascia extends as a facial process, and it forms the anterior wall of carotid sheath, and it covers the viscera. In the anterior part, it is thickened to form the ligament of Barry, and the posterior layer of the pretracheal fascia, where it is splits into enclose the thyroid gland, it is very thin. So any inflammation of the thyroid gland, swelling of the thyroid gland occurs on the backward side, and it causes the obstruction of the esophagus, causing dysphagia. And Coming to the prevertebral fascia, it forms the posterior wall of the posterior layer of the carotid sheath, and it covers the cervical vertebra and paravertebral muscles, and also it covers, the facial spine covers the levator scapularis, scalenus posterior, scalenus medius muscles, and it is attached and it is disappears below the trapezius muscle, and it forms a tubular investment around the axillary, called axillary sheath, which extends up to the apex of the axilla. In the tubular axillary sheath, we have trunks of cords of brachial plexus as well as subclavian arteries present, which is also derived from the prevertebral fascia. Carotid sheath, it is a neurovascular bundle, consists of common carotid, internal carotid arteries, internal jugular vein, and vagus nerve. In the common carotid artery occupies the medial extent, and internal jugular vein occupies the lateral extent. In between, this vagus nerve lies in the most posterior aspect. The anterior wall of the carotid sheath is formed by tracheal fascia, and the posterior wall is formed by prevertebral fascia. And one more thing about the prevertebral fascia is, below the prevertebral fascia splits into two layers, that is anterior layer and posterior layer. Anterior layer, it is called as alar fascia and blends with the buccopharyngeal fascia covering the constrictors of pharynx. Posterior fascia, it is continuous with the anterior longitudinal ligament of the thoracic vertebrae. That's also the vertical layer down, vertical tracing below tracing of the prevertebral fascia. And coming to the carotid sheath, the anterior wall of the carotid sheath, it is formed by prevertebral layer, and the posterior wall, it is pretracheal layer. The posterior wall, it is formed by the prevertebral layer, and that's about the carotid sheath. And coming to the some spaces present in the pharynx, around, in and around the pharynx, that is retropharyngeal space and lateral pharyngeal space. So the retropharyngeal space is situated behind the pharynx, so the lateral pharyngeal space is situated on the lateral side of the pharynx. So the lateral pharyngeal space is bounded anteriorly by the buccopharyngeal fascia covering the superior constrictor muscle. Behind prevertebral fascia, on either side we have carotid sheath, and also the above it is bounded by the base of the skull, and below it is continuous with the superior mediastinum of the thorax. And coming to the lateral pharyngeal space, and in the retropharyngeal space, we have seen some loose areolar tissue is here in the retropharyngeal space, along with pharyngeal plexus and nerves are seen, and sometimes lymph nodes are also seen in the retropharyngeal space. Coming to the lateral pharyngeal space, it is bounded medially by the pharynx and palatine tonsil, and also palatine tonsil, laterally by the parotid gland here, and also ramus of the mandible along with medial pterygoid. Behind we have carotid sheath and styloid process along with styloid group of muscles. So that's about the lateral pharyngeal space. The lateral pharyngeal space and retropharyngeal space, they are the common sites of infections, and the infection spreads here easily. From here, the retropharyngeal space is the infection spreads easily to the superior mediastinum of thorax. And one more thing is carotid sheath. Carotid sheath usually exposed in block dissection in order to remove deep cervical lymph nodes. So that's about the deep cervical fascia or fascia coli. Topic